What if I told you that one of the most common things men quietly worry about during intimacy is something that's actually designed by the human body to protect, to comfort, and to bring pleasure? And yet, most men have never had a single honest conversation about it. Not with a friend, not with a doctor, not even with their partner. That changes today. Hey, I'm a board-certified urologist and men's health specialist, and I've spent more than 12 years helping men navigate their bodies, their confidence, their dignity, and yes, their relationships. This channel is built on one simple idea. Men deserve open, honest, sometimes blush-worthy conversations about the topics they usually only whisper about behind closed doors or search for late at night in a private browser tab. This is a safe space. No shame, no judgment, just real talk about intimacy, vitality, and the things that truly matter in a man's life. And here's what I've learned after more than a decade of doing this. When men are willing to learn, willing to listen, and willing to have these conversations out loud, they heal, they connect, and they realize they were never alone in the first place. So let me ask you something directly. Is it actually safe to swallow vaginal fluids during oral intimacy? What about the taste? The smell? Is that normal? Is it healthy? These questions might sound simple, but the answers, or more often the lack of answers, have a real impact on a man's confidence, on closeness between partners, and on whether intimate moments are filled with joy or awkwardness. And here's the thing. Most men have absolutely no idea what the science actually says. They're guessing. They're assuming. And sometimes they're pulling away from their partner because of fears that have no basis in biology. Today, I'm going to give you the full picture, the medical truth, the biology, and just as importantly, the emotional side of all of this so you can walk away from this video with zero fear, zero shame, and a deeper sense of trust with the person you love. Before we get into it, drop a comment and let me know where you're watching from. I always love seeing how far this community reaches. And if this kind of real, no-nonsense men's health advice is something you value, hit that like button and subscribe. It makes a bigger difference than you think, and it helps more men find conversations like this one. Now, let's start with the single most important thing I want you to walk away with today. Vaginal fluids are not dirty. They are not toxic, and they are absolutely nothing to be ashamed of. For healthy couples, they are generally safe. That's the medical reality. These fluids are produced by the body with purpose. They're designed to protect delicate tissue, to fight off infection, and to make intimacy comfortable and pleasurable for both partners. I know there are common fears out there. Some men worry that contact with these fluids is somehow unsafe. Others are thrown off by an unfamiliar taste and immediately think something must be wrong with their partner. But the truth is far simpler and far more reassuring than most people expect. Variation is normal. Safety is absolutely possible. And communication is the key that holds it all together. When you understand the biology behind what the body does, you stop seeing it as something taboo. You start seeing it for what it really is, which is the body's brilliance on full display. I want to share something from my own experience as a physician, because I think it matters here. Over 12 plus years in practice, I've watched the same pattern unfold again and again. Silent worries, the kind men never voice, slowly eroding their confidence, their sense of connection, and even their sense of masculinity. I've sat across from men in their 40s who are navigating intimacy again after a painful divorce. Men in their 60s and 70s who found new love and want to show up fully for their partner. Couples who've been together for decades and are trying to rekindle something that quietly faded. And what I've seen, without exception, is that when a man takes the time to understand how fluids work, what's normal and what's not, and how to approach the whole subject with care and curiosity rather than fear, the shame dissolves. And what replaces it is a deeper, more authentic kind of intimacy. That's not a theory. That's something I've watched happen hundreds of times. Now, let's get into the specific mistakes that trip men up the most, and we're going to count them down. Starting with number 5. A lot of men make the mistake of thinking vaginal fluids are just moisture, just the body's version of a little lubrication and nothing more. But that couldn't be further from the truth. Vaginal lubrication is, and I don't say this lightly, one of biology's masterpieces. It comes from multiple sources, each with its own role. The The Bartholin's glands, located near the vaginal opening, produce a silky fluid whose primary job is to reduce friction and make penetration comfortable. Then there are small glands near the urethra that contribute their own form of lubrication. And in some women, these are also involved in what's commonly known as female ejaculation. And then there's the cervix, which produces its own mucus. Even outside of a woman's fertile window, the cervix is contributing fluid that plays a role in the overall environment. All of this exists for a reason. It prepares the body for safe, pleasurable intimacy. And when you dismiss it as just moisture, you're not only missing the science, you're missing nature's entire design. Mistake number 4 is one I hear constantly. Men assume that if the taste or smell is different from what they expected, something must be wrong. Let me be very clear about this. Vaginal fluids naturally vary. They change based on diet, hydration, stress levels, hormonal fluctuations, and even medications. These are living, dynamic fluids, and they're supposed to change. For example, when a woman's diet includes more fruits like pineapple or berries, and she's well hydrated, the fluids tend to be lighter and fresher. On the other hand, things like garlic, alcohol, and coffee can make the taste and smell stronger. That's not a problem. That's just chemistry. And the menstrual cycle plays a major role too. Around ovulation, fluids tend to be more abundant and relatively neutral. Around menstruation, there can be a metallic quality. After menopause, there's often less fluid overall, and it may lean slightly more acidic. None of that is bad. None of it means something is wrong. It's individuality. It's biology doing exactly what it's supposed to do. Now, I will say this. The one time to pay attention is if there's a sudden, noticeably unpleasant change in smell or taste, especially if it's accompanied by itching, discomfort, or unusual discharge. That can signal a simple imbalance, something like bacterial vaginosis or a yeast issue, and it's very treatable. But that's the exception, not the rule. Day-to-day variation, completely normal. Mistake number 3 is forgetting that health status matters. Let's talk about what vaginal fluids actually contain. They're mostly water, along with amino acids, enzymes, glucose, and lactic acid. That composition is inherently protective. It helps maintain a healthy pH balance, and it supports the vaginal environment in fighting off harmful bacteria. However, and this is important, vaginal fluids can also carry sexually transmitted infections. Chlamydia, gonorrhea, herpes, and yes, even HIV. That's no different from semen or blood. Any bodily fluid that comes into contact with mucous membranes carries some level of risk if an infection is present. So the safety of oral intimacy depends heavily on health status, both partners' health status. And this is where the conversation about testing comes in. I know some people feel like bringing up testing is unromantic or kills the mood, but I promise you it does the opposite. Having that conversation builds trust. And it shows your partner that you care about them and about yourself. That's not a mood killer. That's the foundation of real intimacy. Which brings us to mistake number 2, avoiding the testing conversation altogether. This is one of the most common things I see. Men who are terrified to bring up the subject of STI testing, afraid it'll offend their partner, afraid it'll imply distrust, afraid of what the results might show. I had a patient a few years back, a man in his 60s, who came to me in a genuine panic. He'd recently been intimate with a new partner and realized afterward that he had bleeding gums. He was terrified he'd been exposed to HIV through oral contact. Now, the actual risk of HIV transmission through oral sex is low, but it's not zero, especially when there are open sores or bleeding gums involved. So we talked it through. He and his partner both got tested, and the results came back negative. But here's what mattered most. That experience didn't push them apart. It brought them closer. They became more open with each other, more honest. And their relationship grew stronger because of it. That's the lesson. Safety doesn't weaken romance. It strengthens it. Every single time. And now, mistake number 1, the biggest one, the one that does the most damage, responding with shame. When a man recoils during oral intimacy or makes a joke about the taste or smell or worse, criticizes his partner, even subtly, the effect is devastating. It creates shame in her that can shut down intimacy, not just in that moment, but for weeks, months, sometimes years. She may never bring it up, but she'll carry it. And the distance it creates between two people is very real. So what should you do instead? Be kind. If something feels different, suggest a shower together. Make it playful, not clinical. Encourage hydration. Focus on the idea that you're a team. You're in this together. Because here's something that might surprise you. Acceptance is one of the most powerful forms of arousal there is. When a woman feels fully accepted by her partner, without conditions, without hesitation, her level of trust and arousal deepens in ways that benefit both of you. That kind of acceptance doesn't just improve intimacy, it powers it. Let me give you a few practical tips you can take with you right now. First, talk openly with your partner about fluids, taste, smell, and health. I know it feels vulnerable, but that vulnerability is where real closeness lives. Second, get tested together as a routine. I recommend at least twice a year, and frame it as something you do as a couple, not as a suspicion. Third, take care of the basics. Hydrate well, eat a balanced diet, and shower before intimacy. These small things make a noticeable difference. Fourth, when changes happen, and they will, face them together with compassion rather than alarm. And finally, celebrate acceptance. For healthy couples, swallowing is safe, and for many women, it feels like the ultimate expression of acceptance and closeness from their partner. That emotional dimension matters just as much as the physical one. I want to close with something that I think a lot of you need to hear. You are not too old for intimacy. Passion doesn't retire. Trust doesn't expire. And love, real love, only deepens with time. If you've been carrying quiet fears about any of this, I want you to release them right now. Thousands of men have the exact same questions you do. You're not strange for wondering. You're not alone in your concern. You're human. And when you approach intimacy with wisdom, with respect, and with genuine acceptance, you're doing more than just protecting your health. You're nurturing a connection that can bring joy at any age. So here's your direct answer. For healthy, infection-free couples, yes, it is safe. Variation in taste and smell is completely normal. And the real secret to all of this isn't found in a medical textbook. It's communication, it's trust, and it's compassion. If this video helped you, give it a like. That one small action helps more men find this information. And believe me, they need it. Subscribe to the channel if you haven't already. I put out new advice every single week, and I'm here to make sure no man has to navigate these questions in silence. Drop a comment and tell me where you're watching from. I'd love to know. And remember this, your age is not the end of your vitality. It's the beginning of a wiser, freer, more confident chapter. The kind of chapter where you finally stop worrying and start living fully. Your health fuels your confidence. Your confidence fuels your connection. And your passion, it has no expiration date. Take care of yourselves, and I'll see you in the next video.